Hello, and welcome to this week's edition of the Sports Medicine Research Podcast webinar. My name is Danielle Torp, and I'm going to be talking to you about some of the recent work that we've done in our laboratory here at the University of North Carolina at Charlotte, specifically focusing on taking steps following ankle sprains. Our lab is interested in using biofeedback techniques to improve motor learning during rehabilitation for lower extremity injuries. Today we'll be reviewing results from two recent publications from our lab focused on gait retraining in individuals with chronic ankle instability, or CAI. The first study is the effects of real-time video feedback on plantar pressure measures in individuals with CAI during walking, and the second will be external feedback during walking improves measures of plantar pressure in individuals with chronic ankle instability. Real-time video feedback is a common rehab technique used by many clinicians to treat a variety of musculoskeletal injuries that are associated with movement pattern dysfunctions. Previous research has established that aberrant gait patterns can arise as early as 2 weeks following an ankle sprain and is very prominent in individuals with CAI who experience multiple ankle sprains. Currently, there is lack of evidence-based practices in how to treat altered gait patterns following ankle sprains. So our first clinical question was to answer if individuals with CAI can positively respond to real-time video feedback during walking. The implications of the study is to determine how to reduce the inherent risk of recurrent ankle sprains that is thought to occur due to these abnormal biomechanics. Furthermore, early onset of ankle osteoarthritis is theorized to occur from repetitive joint trauma and abnormal joint loading. Therefore, the treatment of these abnormal gait patterns following ankle sprains is a very necessary step to take for long-term recovery. Our participants reported to the lab and were fitted with plantar pressure insoles. They walked on a treadmill at their natural and comfortable walking pace. When they felt that they were walking comfortably, we collected a 30-second baseline trial. After this, we projected this exact same image onto a TV screen mounted directly in front of the treadmill. We then played this video in real time and asked our participants to focus on their foot. We asked them to focus on the outside of the foot where this red box is, and to walk in a way to where they can't see the outside of their foot, but to not overcorrect so much that they're then being able to see the inside of their foot. Our main outcomes of interest from our plantar pressure system were contact area, time, peak pressure, and a pressure time interval. Our main focus was reducing plantar pressure on the lateral column of the foot. It's theorized that these individuals experience recurrent sprains because they are placing excessive pressure on the lateral side of their foot, making them more susceptible for an episode of uncontrollable inversion at the ankle, which could potentially cause tissue or joint damage. We then compared our outcomes of interest between our baseline and our feedback trials. The results of the study showed that we had 73% of our participants were able to have a meaningful change in their plantar pressure in the lateral column. And by meaningful change, I mean exceeding normal values that we see for just testing procedures. So 73% of our individuals had a significant change in their lateral plantar pressure. However, when we look more closely at this, we actually see that 47% of those that had a meaningful change were in the opposite direction. So they actually had a negative response to this video feedback, where they increased their lateral plantar pressure. With that, 53% of them that had a meaningful change actually had a positive response. So they were able to actually reduce the lateral plantar pressure. The clinical importance of this is that real-time video feedback and mirrors are very common strategies that are used by clinicians to promote proper movement patterns. However, from this study, only a small portion of the individuals with CAI were actually able to positively respond to our video feedback, whereas the other half of them actually had a negative response. So the clinical application of this is that perhaps our movement cues that we provided our participants while walking wasn't the best to promote a neutral walking gait, and we should still be exploring other forms of gait retraining devices. This leads us to our second clinical question, attempting to answer if these individuals can respond to an external focus of attention feedback using a novel cross-line laser device while walking. External focus of attention is defined as directing the attention of the individual's movements to that of the context of the environment. Whereas with our video feedback, which used an internal focus of attention strategy, which is defined as making the individual more conscious of their own movements. So the implications of using an external visual feedback stem from previous research demonstrating the success of external feedback in promoting motor learning and retention of movement performance. Therefore, since our traditional clinical methods were unable to elicit consistent beneficial changes in gait, we wanted to explore other strategies to accomplish this. For our external visual feedback trial, we attached our novel cross-line laser to the top of the foot, and we placed them in a neutral stance, shoulder width apart, facing the wall. And we then turned on the laser, and the laser was projecting onto the wall, and we placed a piece of white athletic tape over where that vertical line of the laser was to indicate a neutral stance. We then asked them to return to their comfortable walking pace that they did during their baseline trial. And then we had them walking on the treadmill. So as you can see, this is what the laser looked like projected onto the wall in front of them while they walked. And what we asked them to do is the white piece of tape that was placed on the wall, we asked them to walk in a way that the vertical line of the laser would be in line with that of the tape, and to walk in such that they would reduce the amount of rotation of the cross line. So once they were doing this comfortably, we collected a 30-second trial of their plantar pressure measures. And again, we were interested in the same plantar pressure outcomes. And again, trying to reduce those outcomes in the lateral column. Except for this study, we also looked at the center of pressure trajectory during the stance phase of gait. The results of this study showed that our laser device was able to produce beneficial reductions in the lateral plantar pressure, while simultaneously increasing plantar pressure at the great toe. And these black dashes represent no changes in any other region of the foot. So we're comfortable in saying that they didn't walk in such a way to reduce their lateral plantar pressure that it caused them to have such an unnatural gait. And when we look at our center of pressure trajectories, so you can see here our baseline center of pressure, you can see that increased plantar pressure on the lateral side, and the red line indicating a laterally deviated center of pressure trajectory. However, during our feedback with the laser, you can see that reduced lateral plantar pressure and this medial shift in that center of pressure trajectory. So the clinical importance of the study showed that the laser can be a good tool to use as an external visual source in individuals with CEI during walking, and it actually elicited beneficial gait changes in this population. And this is important based on previous research, which also suggests that an external focus of attention is more beneficial during early phases of learning. So the clinical application of this is that you should be using gait retraining in your early rehabilitation phases using an external focus of attention feedback, specifically following ankle sprains. In the literature, there are other methods that have been reported on gait retraining. Two specific ones most recently are using an auditory feedback device, and this study actually saw similar changes in plantar pressure as our laser device did. So this auditory device is also a means of external focus of attention feedback, so that kind of aligns with our laser device. And then the next one that was recently published is a novel gait retraining device. So Figure et al. Used this device over the course of 5 to 10 days for a total of 1 to 2 hours of actual gait training, and they did see improved plantar pressure and muscle activation in the lower leg. So the results of these studies show that it is important for individuals with ankle sprain histories to do gait retraining using some type of biofeedback. and so the literature is promising on that. So some take-home messages from this webinar is that gait retraining should be included into a rehabilitation plan following ankle sprains. Specifically, you should be implementing these in the early phases of rehabilitation when these patients have regained their ability to ambulate, but before they're ready to do more functional tasks such as jumping and hopping. And it should be noted that you should also be simultaneously strengthening the lower leg and hip muscles while teaching these patients their new gait pattern. The other take-home message is using internal focus of attention feedback, either through videos or mirrors, may actually interfere with the patient's ability to learn and adapt their movement patterns. So it's recommended that using an external focus of attention to train or learn a new motor pattern might be the most beneficial in patients who are recovering from lower extremity injuries. And that's it for this week's edition of the Sports Medicine Research Webinar podcast. Please check back to find future webinars from our staff. Thanks. Bye.